Susan is 27 years old with epilepsy that is luckily well controlled with medications. She is married and she asked me if she can get pregnant and what to expect during her pregnancy in terms of medications and seizures. She really wants to have a healthy and smart baby like her. First, I reassured her that she can carry a normal pregnancy because her seizures are well controlled. We will make some adjustment as her pregnancy goes. I'm sure you too have questions about epilepsy and pregnancy. I'm Dr. Omar Danoun, an epileptologist or epilepsy specialized neurologist. I will answer all of these questions and bring you the latest and greatest updates from the American Epilepsy Society conference where all the great epilepsy doctors meet and learn. How to prepare for a healthy pregnancy and epilepsy. Is pregnancy dangerous in epilepsy? Can epilepsy worsen pregnancy? Can pregnancy worsen epilepsy? Do anti-seizure medications need to be changed during pregnancy? Can anti-seizure medications affect the baby? What are the safe seizure medications for epilepsy? What are the medications to avoid during pregnancy? Can anti-seizure medications cause autism in the baby? Can epilepsy people deliver normally? I just wanted to remind you that this video is for information only and is not intended to replace qualified medical judgment. First question, how to prepare a healthy pregnancy in epilepsy? Before, we did not know much about epilepsy and pregnancy, and unfortunately, we used medications that later proven to be harmful to the baby. Now we are much better at caring for women with epilepsy during pregnancy, and this is reflected in a healthier and smarter babies. We start preparing for pregnancy years before. We know that epilepsy is a chronic condition and needs long-term treatment for years. So when we choose an anti-seizure medicine for girls or women of childbearing age, we choose a medication that is safe during pregnancy. We will talk more about these medications in a little bit. Second, we have folic acid that can prevent any harmful effects on the baby. So it is recommended for every woman of childbearing age to take folic acid daily. So if she gets pregnant, then she has enough stores in her body to nourish the baby. Second question, can epilepsy worsen pregnancy and can pregnancy worsen epilepsy? Likely not. Recent high-quality studies showed that the best predictor of how you do in pregnancy in terms of seizures and seizure control is the last 9 months before pregnancy. So tell me how you did in the last 9 months and I will tell you how you will do during pregnancy. Of course, when monitored closely and with medications adjustment. I tell my patient when she gets pregnant, she calls her husband first and then call me second to arrange for a pregnancy plan. Epilepsy is considered high-risk pregnancy and pregnant women with epilepsy should follow closely with her neurologist and the experienced OBGYN doctor. Having generalized seizures during pregnancy can have bad outcomes and even loss of the fetus. That's why we work very hard to control seizures well during pregnancy. If this video is of value to you, please hit the like button to spread to more people. Thank you. Susan is maintained well on levetiracetam 750 mg twice a day. She's wondering if the medication needs to be changed during pregnancy. She is following up with me frequently and with her OBGYN doctor as well. This leads to our next question. Do anti-seizure medications need to be changed during pregnancy? Yes, during pregnancy, the body changes so much and starts clearing up the medications and process them much faster, and you will end up with less medications than you need. We recommend getting blood levels of anti-seizure medications at the beginning of pregnancy, then watch them very closely and increase the medications doses every 2 to 3 months to keep good medication levels during pregnancy, and your neurologist will watch you very closely with that. These medications drop so much during pregnancy and needs to be watched very closely. Now let's talk about seizure medications effects on the baby. Can anti-seizure medications affect the baby? What are the safe medications for epilepsy during pregnancy? And what are the medications to avoid during pregnancy? We measure the medication's effect on the baby through 2 major forms. The first one is major congenital malformation, which is the birth defects or abnormal shape or of any organ, like the cleft lip or neural tube defects, so we need to have a good looking baby. Second is the cognitive effects, which are the effects on the baby's IQ or intelligence and cognitive function. We need smarter babies as well. Let me tell you this information. What predicts how smart the baby will be? No, it is not the dad's IQ. Not even the average of both mom and dad's IQ. It is only the mother's IQ. So if you are smart, then your kids will be smart too. Go tell your husbands that. If you go downtown New York or any population, the risk of normal pregnancy having major congenital malformations is between 1 and 3%, which is considered low, and 3 out of 100 births can have this malformation. To answer the question of the effects of anti-seizure medications on the pregnancy, we did not have good data before. But now, with strong work for many good teams around the world in working with pregnancy registries, following women taking anti-seizure medications and checking them for birth defects rates and cognitive outcomes in the children, we now have answers for you for these questions. The safest medications for epilepsy are levetiracetam or Keppra, lamotrigine or Lamictal, and oxcarbazepine or Trileptal, with risk ranges from 1 to 5%, which is slightly higher than 1 to 3% in the general population. So these are the best medications to be on during pregnancy. These medications have a little more risk for malformations like carbamazepine, phenytoin, and phenobarbital, ranging from 1 to 7%. The higher medications risk are topiramate and phenobarbital. Topiramate can cause cleft lip and should be avoided as much as possible for epilepsy and not given at all for any patients with migraine headache during pregnancy. The worst medication and the bad boy for pregnancy that no pregnant woman should be on is the valproate or Depakote. This medication can cause high risk for malformation that reaches up to 14% and even can cause cognitive issues and drop in the IQ by an average of 7 points. Also, it can cause autism in the children. That is why we do not put any woman of childbearing age on valproate because of these risks, not mentioning the massive weight gain and all the other side effects. The effect is dose dependent, meaning that the effects on the baby changes with the amount of medications you take. The higher the dose, the more the risk, and the more medications combined also have a higher risk. Another question is, can anti-seizure medications cause autism in the baby? One medication, which is valproate or Depakote, can cause lower IQ by 7 to 10 points, which is a lot, and also can cause autism and ADHD in the baby. See, that's why it's a bad boy and we don't use it for any women of childbearing age. Other medications seems to be having no effects or yet do not have enough information for them being new on the market. I will take this opportunity to invite you to participate in these registries in your country. I will leave their numbers down below in the video description for you to call them and they will enroll you in the study. This way you help advance the science and next time you take credit for the new information. I thank all the women who participated in these registries all around the world. We yet need more information on the newer anti-seizure medications that are still under investigation. And now you delivered and thought about breastfeeding your baby. Do you know that if you breastfeed the baby, that will increase their intelligence by at least 4 points? To learn more about this, please see this video about epilepsy and breastfeeding, and stay healthy and see you in the next one.